Hi, I'm Robin, the Executive Director of Alabama Arise. I wanted to share some information and resources that I hope can be helpful to you and your community as we navigate what is an unprecedented crisis impacting everyone in our communities and in our state. First, I want to extend my warm wishes to you and your family and loved ones. We know that these are difficult and challenging times. Like many of you, our staff is concerned about the health and well-being of our families and our community. But we're especially concerned about people who've lost jobs and income, people who don't have health insurance, and people who are staying awake at night worrying about how they're going to feed their families or pay their bills. So we really, truly hope that these resources will be helpful and that you can share them with people you know. I'm going to talk a little bit about unemployment insurance, SNAP benefits, and health care. So the first thing to note about unemployment is that Congress has recently expanded benefits so that anybody receiving unemployment insurance should receive an additional $600 a week. This is a tremendous support. We know our state is going to be backlogged for weeks with the huge influx of applications for unemployment insurance, but we urge anybody who's lost income or lost a job to go apply. The other thing to note is that people who are previously ineligible for unemployment assistance now are eligible due to the pandemic unemployment insurance. You can find more information about both of those programs on our website, alarise.org, where Dev Wakely has put together a comprehensive blog post discussing these programs and what's available. Dev also talks in that post about some of the tax rebates that'll be coming soon for families, so please go check that out. The second thing to discuss is SNAP. Now, Congress has passed 3 rounds of stimulus and bailout funding for the coronavirus. They have not done nearly as much as we hoped they would do to expand SNAP benefits. But one thing they did very early on was to ensure that anybody receiving SNAP will now receive the maximum benefit. So if you were receiving anything less than the maximum, you may have noticed you received extra benefits on April 1st. Those expanded benefits should continue through the end of this emergency. We'd also like to extend more benefits to even more families. And we know that our state SNAP office is also overwhelmed with applications during this time. Please go visit our website where Carol Gunlock has a great blog post highlighting the various types of food assistance that are available. Again, that's at alarise.org. The last thing to discuss is healthcare, and obviously healthcare and health coverage are top of mind for many of us during this public health crisis. We have advocated for years to expand health coverage. One thing to know immediately is that if you or a friend or family member loses health insurance, they are still eligible to visit healthcare.gov and apply on the health insurance marketplace. There is financial assistance available to make that insurance more affordable for many people. But if your income is below a certain level, as always, you are going to be in the coverage gap. So I want to highlight one action alert we've put out this week. We're continuing to target Governor Kay Ivey to ask her to expand health insurance benefits by expanding Medicaid. You can take part in that action alert by visiting alarise.org and clicking on Take Action. Thank you for all of you who already have and who will continue to do so. We have to continually speak out for the value of expanding health coverage to all of our friends and neighbors. Alabama is among the most vulnerable states to the coronavirus epidemic because of the high rates of health complications and vulnerable populations. We had a Q&A with Governor Kay Ivey on Twitter Thursday, and many of y'all spoke out to say that health insurance and Medicaid expansion was among your top concerns for the governor to consider. So we have to continually follow up to let her know we're expecting a clear answer on that. Our policy director, Jim Carnes, put out a great video last week highlighting some of our other recommendations for our state's Medicaid program. And we know that they, like every other program, are working as hard as they can to implement as much as they can. Another thing that has changed is anybody who doesn't have health insurance should still be able to go get a test for the coronavirus at no cost. But how will people get treated? This is a top concern for us. So we're going to have many more advocacy updates and alerts over the next few weeks. We'll share more updates next week about some of the other administrative advocacy that we're pushing. Every state agency is on the front lines of addressing this crisis. To those of you who are also on the front lines, whether you're healthcare workers, grocery store employees, sanitation workers, child care workers, the parents who are at home homeschooling your kids and caring for kids that you didn't really expect to have to care for, I salute you. We are with you. We want to help you with information and resources that you can use to get the resources you need to keep your family and your community safe. Thank you for your support for Arise. If you haven't already, please sign up for our email alerts at allarise.org. You can also join as a member. And thanks for being with us. Take care.